Hi, my name is Jazzy Daniels. This is my how-to oral presentation for English 155. My presentation is on how to change a resident while in bed. When working in a nursing home, you are assisting residents with all of their activities of daily living. There are some residents that cannot help themselves, and that's where the CNA comes in. Not all residents can get up and go to the bathroom on their own, and there are some residents that you can assist to the bathroom, but there are others that are confined to the bed, such as tube feeders. A CNA must make their rounds at least one to every 2 hours to check for soil breeds or wet breeds. If you notice while making rounds that a brief is soiled, you must take that brief off to prevent any breakdown. Now, the difficult part of a job in a nursing home facility is changing a resident while in bed. And I'm going to demonstrate and explain to you how to do that. When you go into a resident's room and you notice that they're soiled, you are supposed to change their brief. What I do first is I get all my necessary supplies. I get my brief and I go and get my wipes or chucks or a washcloth if it's that bad when you have to do a quick wash up. The first thing I do is unfasten the brief. Once I have unfastened the brief, I take this tab and I roll it under the resident as much as I can. Then I take the front of the brief and I roll it in between the legs. Be careful not to just shove it down and tear skin. The elderly skin is very fragile and you can't tear by the slightest skin. Then I get me a wipe. If it's just a wet brief, you can use one wipe. But if it's a bowel movement, then you may need to use multiple. So this is what you will do in the event that you just clean up a wet brief. You will take your wipe and you will wipe inside the corners. And you will make sure that you're using a different area of the wipe each time to prevent spreading any germs. And then you will wipe down the middle. Then I discard my little wipe. Then what I do is I rotate and roll my resident towards the opposite side from me where there's a side rail or the bed is placed for a while so it doesn't fall. And I roll them over as I take my brief and I discard it. Then I get my clean brief. I open it out and I roll as much of the far side under as I can. So when I roll my resident back, they'll be at least middle waist inside the brief. Then I roll back. I like to go ahead and pull my brief open and fasten that one side that I'm on. Then I roll my resident towards me and pull out the far side. And I roll them back. Then I take this side and fasten. And that's how you change your resident while in bed. Any questions?
Yes, what if you encounter a resident that is slightly larger than your sample and it is more difficult to do so by just rolling?
Okay. On my example, I'm using this as a draw sheet. And if your resident is slightly larger, then you can roll on your own. What you should do is pull and roll over. This is called log rolling. You can once you have your resident up, you can let the draw sheet down, change your resident as I demonstrated, and then you will roll the resident back. On this side, I have more of the draw sheet than on this side. So what I would do is take this side and pull it back so it's even out and the resident is in the middle of the bead.
So does the sheet for the larger patients stay on their bed at all times?
Yes.
So what happens if that particular sheet becomes soiled and it needs to be changed along with the group?
If this sheet needs to be changed, this is how you will do that when you get ready to change. You will lay your resident is in bed. You will open your brief out, and that's why I said I like to roll things up under. That way, when I do roll my resident, I can pull with that same sheet and roll them over, and everything is up under them. So when they're over this way, I can put my draw sheet under by making sure it's rolled and put it on top of the soiled linen and the brief and roll it up under. Place my brief on top of that by rolling under it, rolling my resident back, and then once I roll them back, I can roll that out and then pull them if you need to make sure they're in the middle of the bed.
That's a lot of rolling. Does that ever injure the residents or is handled with delicacy?
It's handled with delicacy. Well, being that this is a dog, I'm going to take this brief off and show you how it would be on a real life person. When you're rolling someone, to prevent injury, what you do is you can roll the leg over. If they're larger, you roll that leg over and then you roll them over like that. That way it's easier on you to roll them and it's easier on them to be changed instead of trying to find someone to help you get them up, take them in the bathroom, and it's just easier this way.
Have you ever encountered where a resident can't be rolled?
You never encountered that before because all residents can be rolled, even if they're contracted. You use the draw sheet to roll them over. Now, there may be cases where a resident's leg is contracted like this, and when you roll them over, it gets difficult putting the brief in. But what I do is I take my brief, and I'll demonstrate that. Once I have stuffed it under, I take my brief, and I just slightly pull the knees away from the other knee and push the brief in, being careful not to scrape or pull hard to tear their skin. And then I roll them back. Fasten my brief, and then use the dry sheet to roll them over again and pull it under. And then very good. Very good. Thank you.